From Cape Town, South Africa. I've had problems with my knee for the last 30 years, and after my last operation, knee operation, about 12 weeks ago, I decided to have a total knee replacement done. Now, there was a couple of very important factors for me that I need to consider before I was going ahead with this operation. Firstly, I wanted it done by a professional. The second thing, I wanted a specific knee because I'm a very keen sportsman, and after my total knee operation replacement, I still wanted to play sport. And the third thing that was important is obviously the cost of the whole operation to me. Being a private patient, I had to pay, or I have to pay for this operation myself with no assistance from any medical aid. After I've decided on the total knee replacement, I did a lot of research and I came across the Chettinand Hospital in Chennai and Dr. Venkat. We then decided that we're going to go ahead with the operation, and obviously I had a lot of questions to be asked. A lot of correspondence went backwards and forwards between myself, Dr. Venkat Hospital. It was always handled in a very professional manner. It was responded to very quickly and timeously, and all my questions were answered almost immediately, which of course put myself at ease with the whole process. On arrival in Chennai, we were met by the hospital manager who fetched us at the airport, and he brought us through to the hospital. Everything was done professionally. From the moment we checked in, everything was done for us. On the first day of arrival, we did the medical checkups and all the formalities were taken care of. X-rays, ECGs, blood tests, etc. And Dr. Venkat decided that we should go ahead with the operation the next day, which was the second day after my arrival. He also suggested, with my consent, that we should use the epidural system, whereby throughout the operation I would be awake and fully aware at what was happening around me. We agreed that that was the way to go, and I gave my consent. The morning of the operation, I went into the theater, and all the prep work were done by professional people, and I was awake throughout the 2.5-hour operation. From there, I was taken out into the ICU unit, and I was going to stay there for 2 or 3 days to recover. On my first afternoon in the ICU, the physiotherapist came around and we had a chat. And the very next day, the second day after the operation, I was up and standing and obviously doing some exercises with the physiotherapist. Throughout this whole process, the ICU took care of me. Blood tests, all that had to be done were done in ICU. 24 hours, they were there and looking after me. On the second day of my operation, Dr. Venkat discharged me to my private ward, and I got sent back for further recovery. In my private ward, everything was taken care of. It was a luxury unit with a double bed unit, a bathroom, a lounge, and a kitchen. And everything was there that we needed. The medical personnel, the sisters, the doctors were in the room all the time. It was almost heavy traffic the way the medical personnel came around to check up. On the third morning after my operation, I was up and I was walking. I had no pain right throughout the whole process, right from the morning that I went into the theater, right throughout ICU.
And how does your knee feel?
Well, the knee feels fine. I've got no pain whatsoever.
Good. Have you seen your, have you eaten today?
Yes, I've eaten something light, yes.
Right. Okay. Good.
Back en route to recovery, I had no pain whatsoever. On the third day after the operation, I was up and walking, no pain whatsoever. And today, on the fourth day after my operation, Dr. Venkat has decided that I've recovered enough to be discharged to a resort to recuperate further. All I can say about this whole episode is that it was, at first, I was a little bit nervous being a foreign country, to come all the way from South Africa to get the surgery done in a foreign country. But on looking back, it was most probably the best decision ever taken to come here, to meet the people, the professionalism, the care, the people, wonderful. And if anybody ever consider having a total knee replacement done, I would recommend that they contact Dr. Venkat at the Chettinad Specialty Hospital in Chennai, India.